Hello, I am Dr. Jennifer Reisinger, and I am a OB Hospitalist and Site Director in South Carolina. And I would love to share with you a life save that recently happened during one of my most recent shifts. This was a patient who's 26 years old, first pregnancy, really had a healthy pregnancy except for her elevated BMI, which was 56, who was brought in by her private doctor for an induction of labor. Estimated fetal weight was about 9 pounds, felt like she had an adequate pelvis, and so she and her doctor decided that they would go ahead and proceed with induction. After about 1 day of ripening, she finally was favorable and her membranes were ruptured and she had slow but steady progress and finally progressed to complete. And it was about +2 station when she began pushing. She really, really wanted a vaginal delivery, and so the nurses worked with her, and we worked with her with all kinds of pushing positions. And after about 2 hours of pushing, she was worn out. So we talked very cautiously about trying to help her with the vacuum, which she really wanted to try to do. But after two unsuccessful attempts, she and I had the conversation that we probably needed to think about doing an abdominal delivery. So we talked about risks and benefits of C-section. She had an epidural that really wasn't working well. We brought in our anesthesia colleagues who agreed to try spinal anesthetic. When we went to the operating room, unfortunately, the spinal attempts were not successful, so we did proceed with the cesarean under general anesthesia. I'm pleased to report that we have a healthy mom and a healthy 9-pound, 11-ounce baby, and I'm so very glad that we were able to support her and her private doctor in really trying to achieve a vaginal birth. Even though this wasn't a successful attempt, I'm very glad to say we have a healthy mom and a healthy baby. I think one of the real value of an OB hospitalist program is that because we're there to support the patient in their birth and their birth journey, as well as support the private physicians, because we can assume care of the patient, it almost eliminates that crunch time, in terms of we've got to be on the clock or we've got to, have that delivery done by a certain time. Because we can seamlessly just pick up for our private providers in supporting that mom in her journey, I think it helps to decrease those primary section rates. We help to achieve a vaginal delivery. We help to be there in case there's any emergencies. And ultimately, I think we really are advocates for our patients and providing that birth experience that they want. So I'm very pleased that our program has helped to decrease our primary section rate. I think we're a key point in that. And I think that all in all, if we can do that, that'll also provide for better outcomes for women everywhere.